am Kathy Smith-Wenning. I am the instructor for this course, and I am bringing to you a presentation addressing social determinants of health. I did not write this presentation. It was crafted by the the American Hospital Association, Advancing Health in America. It has everything you need to know about social determinants of health, which impact health disparities. Now, the World Health Organization defines social determinants of health as circumstances in which people are born, grow up, live, work, age, and the systems put in place to deal with illness. So each year we've got 1.5 million people experience homelessness. They are unhoused. There's another 3.6 million people who cannot access medical care due to lack of transportation. You know, I've lived throughout the United States. Mostly my other areas were Florida and Texas. But the one place where transportation truly impacted healthcare is in the rural New Jersey and the U.S. 40 million people face hunger, and 11.8% of households are considered food insecure. They don't know where their next meal is coming from. Now, the impact of social determinants of health have a tremendous effect on an individual's health. It doesn't matter how old you are, what your age is, what your race, your ethnicity, or your culture is, it impacts it. So there are many different factors that we can put into categories. Category 1, which is 40%, that impacts your outcomes for health. It creates health disparities caused by social determinants of health or socioeconomic. Your education. Generally, the higher the education you have, the better your health outcome. The higher the education a mother has is a known, documented research fact that the children will be healthier. Job status, is your job secure? Family and social support. Do you have a support system? Or are you always left on your own without anyone to help you out? Income. Do you make enough money? Is your source of income reliable? Is the job that you have not too dangerous? Community safety. Can you walk from the bus home at night and be safe? Can your children walk to school and feel safe without their parents being worried about them the entire time? There's the built environment, which we don't pay much attention to unless you're living in a neighborhood riddled with crime, homicide, lots of evidence of drug use, and the building itself may be sick. The building might have vermin, rats, rodents. Did you know rat urine is an asthma trigger? Cockroach urine in addition to that. Or mold could be in the built environment. So is your physical built environment where you live, is the indoor air quality healthy enough for you to stay healthy, or is it making you or your kids sick? Is your neighborhood safe enough that you will remain safe without risking bodily injury? Is the outside air quality and water quality safe enough that it won't make you sick? That's part of the physical environment. Then we have health behaviors contributing 30% to social determinants of health. Health behaviors include tobacco use of any kind, vaped, cigarettes, pot, you name it, whatever it is, well, it's tobacco. Anything you inhale can make you sick, all right? Diet and exercise. Do you have access to healthy food? Or do you eat carbohydrates all the time because it is the safest, it is the cheapest, nutrition that you can find in your environment? Alcohol use. Listen to me. The American Medical Association has stated frequently in the research that no amount of alcohol is good for you. No amount. There was some earlier research decades ago that it was healthy for you to have a couple glasses of wine. No, it's not. It isn't at all. There is no amount of alcohol that can keep you healthy. There's no amount of alcohol that can ward off cardiovascular disease. All right? That's old research, and it has been debunked. Interesting fact that many people do not know, that not constant use, but daily or weekly use, higher than usual, higher than one drink a day, or around that can contribute to breast cancer. So there's known cause and effect with alcohol consumption and breast cancer, not to mention other cancers. Sexual activity. Sexual activity, if safe practices are not used, can cut your life short and can make you sick depending upon the diseases that are passed back and forth. And we didn't even get into potential pregnancies. Then we have access to adequate and safe health care. Can you get there? Is it adequate? Is it what you need? And what is the quality? Do the people in that institution, do they have licenses? Do they have degrees? Were they trained in the area that you need? That's known as quality healthcare. Now here's this gigantic slide with lots of different topics. So social determinants of health have a tremendous effect on an individual's health regardless of age, race, ethnicity, culture. Got it? Get it? You got it. It's on the test, whatever test there is. Economic stability, we just talked about. Are you employed? Do you make enough money to meet your bills? Do you have enough money or do you have insurance to cover medical bills? Neighborhood and physical environment. Housing, is it safe? Transportation, is it available? Is the neighborhood safe? Are there parks? It is a known, documented fact that the greener the outdoor space, the healthier the air is for the humans that live there to breathe in and keep them healthy. Are there playgrounds? Is it walkable? All right. Are there no sidewalks? Is it all highways and there's no way for you to walk on a sidewalk? Education. Is there literacy training, language training? If you don't speak English, is there adequate ESL opportunities for you to learn English as a second language? Is there access to higher education? And let's not forget vocational training. Vocational schools can prepare people for a variety of meaningful careers that provide an income that can sustain a family. And last but not least, to me, one of the most important part is early childhood education. Does a child have access to education prior to kindergarten? Kindergarten should not be the point of access for a child to learn, just to begin learning the topics that they need to be successful in school. Then we go on to hunger. All right, access to healthy options. Do you live too far to a store that provides fresh fruit and vegetables that you can afford to buy? Or does the bodega on the corner charge an astronomical amount of money for food or for fruit that is rotting, that you won't eat? So therefore, you won't have access to fruit or vegetables. Then there's community and social context. Is there social integration within your community? Is there engagement? Are there opportunities for you to go to street fairs or other events in the community? You feel like you are part of the community. Are there support systems, faith-based groups you can tap into that care about where you live, the conditions of where you live, and who you are? Is there discrimination in any community? It is a known fact that discrimination leads to poorer health outcomes. If you do suffer from discrimination in where you live, what are some of the safety valves? Is there a support system? Are there folks in your ethnic enclave that can make you feel more secure? You would need to reach out to find like-minded people to help you feel more safe. And they can give you information, anecdotal information on how to feel safe. Let's not forget health systems. Do you have adequate health coverage? It doesn't matter if it's from the government or it's local, or do you have to rely on free health coverage at faith-based clinics? Are providers available? Maybe you need a certain kind of a doctor that's not available. And does the provider provide, it's called linguistic and cultural competency. Do they have access to interpretation services? So when you come in, if they don't speak your language, they can get an interpretation service over the phone to help you out and to help you get your signs and symptoms described to the doctor or the nurse in the best way possible for you. And then we have quality of care. As I said before, do the practitioners, do they have adequate education and licenses to provide the services that you need? Now, in an infographic display, remember, social determinants of health categories you need to pay attention to and include housing, food, education, transportation, violence, social support, employment, and health benefits. Are they available? Where do you get them? Can you afford them? Now listen, place matters. Where you live matters. It can actually be a predictor of how long you will live. On this graph, on this ribbon, red has the lowest life expectancy at birth, 66 years. You can see that parts of West Virginia, Alabama, Mississippi, I believe Arkansas and Louisiana have low pockets of low life expectancy. But on the dark green side, in New Jersey, part of New York State, and New York City, not to mention California, we can have a life expectancy that goes up to almost 87 years. But even short distances, there's large gaps. For instance, in Chicago, on my left, it says Chicago, Illinois. If you look at one part in the red, life expectancy is 69 years. But if you continue up the highway, life expectancy goes up to 85 years, which leads you to believe that income and education are a lot higher in the 85-year category than the 69-year category. And then in Mississippi, the gap is not that wide. Life expectancy is a lot lower. It doesn't go up into the 80s. It can be as low as 71 years, and it goes up to life expectancy to 78 years. And then the conditions within the community matters. For instance, Brooklyn, real nearby where we are, we look at homicide rates. So if you look at the lighter colors, you've got the lighter numbers per 100,000 residents. For instance, Bensonhurst, there is under one homicide per 100,000. But if we go to East New York, there's greater than 20 per 100,000. And if we look at the left of the screen, homicides in Chicago neighborhoods, these homicide rates go up as high as 90 per 100,000. But we do have neighborhoods where it's under 1 per 100,000, but escalates through the center at a very high rate. Food matters, food insecurity, risk factors. If you're constantly struggling to find something to eat, what you eat may not matter. You're just interested in finding something that makes you feel full. Food insecurity can lead to different types of chronic diseases, poverty. The chronic diseases, the big one is diabetes. The next one is cardiovascular disease. It impacts unemployment, homelessness, and another biggie for me is developmental delays in children. If you look at Mississippi, look at the food deserts here. Look at the food insecurity in the dark green and the black areas of Mississippi. But then if we look at Chicago, there's very few areas that are food insecure. There's only 11.7% that are food insecure compared to Mississippi with 21.5%. The role of hospitals and health systems with the community, there needs to be internal and external engagement. Internally, hospitals are to provide screening, connect with patients and community resources. They need to know what's available out in the community, and they need to implement hospital-wide initiatives. And then take that information externally, engage with the community, partner with the community, and invest in the community. Role for hospitals. This is an interesting slide. For instance, most hospitals, 84%, provide some type of community health education. 79%, some type of nutrition programming. That's pretty good. Health fairs, 78%. I'm a little discouraged though, only 60% provide some linguistic and translation availability. Tobacco treatment cessation for any kind of nicotine intervention, we're down to 54%. Not good. For me anyway. Interested in, as a respiratory therapist, bringing that way down. Fitness centers, only 32%, and the one that really bothers me is that only 22% provide transportation to the hospital, but 91% or more have community partnerships. So they're doing a pretty good job. Next steps. What does a hospital need to do? 1, engage and know your community. 2, gather data. 3, develop organizational and internal engagement strategies. Integrate social determinants of health into strategic and financial plans. Explore funding options. Any program you do is not for free, it costs money. And 6, establish measurement strategies and evaluation tools to know that what you're doing is reducing social determinants of health, and how would they know that they would see a reduction in emergency department visits and other metrics that they can follow. Don't worry, we're not discussing the slide. And what I want you to take away from this is the idea of population health. For instance, I know Jersey City Medical Center has a department of population health, and within that department, they target the city of Jersey City and the areas of health disparities. Why does this group of people have a higher incidence, say, of asthma? There's a place in Jersey City known as Asthma Alley, and how does the Department of Population Health interact with the community in Asthma Alley to bring down the rate of asthma and help manage the people who are diagnosed with asthma? And then there are other initiatives that help address social determinants of health. And I will allow you to click through the other slides on your own. This one's kind of interesting. ProMedica has a food pharmacy. And interestingly enough, at the food pharmacy, they come in with a prescription of certain kinds of foods they need to purchase from their physician or healthcare provider. 57 patients were screened for food insecurity. 1,100 became food pharmacy clients. An additional 4,000 Medicaid patients were referred to food pharmacies, and food pharmacy patients used the emergency department a number of times less. I cannot see the number on my screen. So that, in a nutshell, helps explain social determinants of health. And social determinants of health, all those different factors can lead to health disparities when one group of people suffers a greater incidence of disease than another group of people. And that is it.